Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In the second part of our series, we will dig a little deeper into testing and treatments for autism.
There can be a sense of the unknown when trying to find answers. What will you have to go through? What does a diagnosis mean and can you afford it? These are some of the questions that can come up. You hope to find a provider who understands and can help. Hopefully, information provided today can alleviate some of those concerns and make you ready to advocate for your child, loved one, or patient.
Remember from our last episode that the American Academy of Pediatrics recommends all children be screened for autism at 18 and 24 months, yet only about half of the primary care practitioners screen for autism. A diagnosis of autism can typically be made by age 2.
So pediatricians are going to look for a couple of things to screen. They're going to look at cognitive level or thinking skills. They're going to look at language abilities, age-appropriate ADLs. So should they be able to feed themselves, or go to the bathroom, things like that.
Absolutely.
Blood screens and then hearing screenings. There was actually a study in 2016 that showed children with autism had deficiencies in hearing in a specific range that is vital for speech, which could really explain a lot of the delays in speech.
Thinking about it, a lot of autistic children have hypersensitivity sometimes to loud noises. I wonder, this will be homework for later, I wonder if that is associated with hearing issues.
I did read the study. I do not remember that part specifically, but there was a lot of information in it, so I very well could have missed that. We'll make sure that study is linked in the show notes.
Oh, awesome.
And for screening children and adolescents, you want to look at social difficulties, so problem understanding tone of voice, facial expressions or body language. You will look for trouble understanding figures of speech, humor, or sarcasm. And parents may also find that their child has trouble forming relationships with peers.
So the main criteria for diagnosing autism is the DSM-5 that psychologists and psychiatrists use, and it has 5 different criterias in which your child or the patient has to meet in order to have this diagnosis of autism. So the first criteria is social communication deficits consisting of 3 items, and all of those 3 items have to be met. The second criteria is a fixated interest and repetitive behaviors consisting of 4 items. And only 2 of the 4 need to be met. The third criteria are symptoms that have existed since early childhood. The fourth criteria is symptoms that are impairing functioning. And the fifth criteria is impairments that are not better explained by an intellectual disability or a global development delay.
And these are sequential. So you meet the criteria A, then you move to B, and then it goes down that way.
Or maybe you have 4, but in order to actually be diagnosed with autism, you have to meet all 5 of the criteria.
Right.
So my experience with this, as my son is diagnosed with autism spectrum disorder, I was taking him to see a pediatric developmental specialist. He has been diagnosed with ADHD since he was 5, and he was being medicated for the ADHD. But then I started noticing some things, that we kind of touched on and reviewed in episode 1. He had speech, but then he regressed around 2 or 3. I remember one year we tried to hold a birthday party at Chuck E. Cheese's. That did not go so hot at all. And to this day, he still does not like puppets. We could never ride carousels. We couldn't go to a local restaurant here in town that has like the Aquaman in the suit and the sharks hanging off the wall. So I would address these concerns with the pediatric developmental specialist, and she would just say, oh, he'll grow out of it. Or, he'll want more food later. He'll eat more as he grows. He's just a finicky eater. And then one year I said, I can't do this anymore. We were getting ready to start the 5th grade. And I was like, this is crazy. Something's not right. And I felt it in my gut. So instead of going back to that physician, I made an appointment with my pediatrician. And I said to her, listen, I can't go back there anymore. She's not listening to me. She's not hearing what I'm saying. And by the end of that conversation, the doctor looked at me and she said, I think your son has autism spectrum disorder. And I just remember tears falling from my face, but it wasn't necessarily because he was diagnosed with autism, but because after all these years of seeing things that I felt in my gut weren't right, I finally had an answer.
And that's what's really important. Some people, they don't want something to be wrong, but they do want answers when they know something is wrong.
Absolutely.
And there's a big difference in that.
Parents everywhere, caregivers everywhere, speak up. If you see something that's not right or it doesn't feel right to you, bring it to your pediatrician's attention.
Absolutely. And what you have to understand is, like you said, he was diagnosed with ADHD at 5. You can have other diagnoses in addition to autism. And there's actually a list of associated diagnoses that are common in autism.
Mm-hmm.
There's GI problems, there's epilepsy, feeding issues, disrupted sleep, the ADHD that we've already touched on, anxiety and depression, OCD, schizophrenia or bipolar disorder, and sensory issues. And so these are common associated diagnoses with autism. It doesn't necessarily mean that just because they're diagnosed with this that they don't have autism. And it doesn't mean if they are diagnosed with these that they do have autism. And that just because you're treating one of those, if there's still things that are going on, maybe something that you need to look a little further into.
Absolutely. I can tell just off of this list, my son had GI issues. He had sensory issues. He was definitely hyperactive.
Mm-hmm.
And all that I was able to notice before he was 5. So it's very important that you're taking your child to their well child visits.
Yes. Because that's when pediatricians will be doing a lot of the screenings.
Absolutely.
Or primary care doctors if they're looking.
So intervention and treatment, as we've stated before, the earlier the diagnosis, the better the outcomes are later in life.
Mm-hmm.
So one of those main therapies for autism is actually called applied behavior analysis, and you'll probably hear it referred to a lot as ABA therapy.
Yes.
And the therapy applies our understanding of how behavior works to real situations. The goal is to increase behaviors that are helpful and decrease behaviors that are harmful or that affect learning. The general principle of this is positive reinforcements.
Mm-hmm.
And just like you finish your homework, you can have a treat.
Right.
Or if they are really into Legos or stickers, whatever they finish or complete as a task, there's a reward at the end of that. You do your homework, you get Legos.
Right. And so what that does is it makes them want to do their homework or whatever the task is without having a lot of behavioral, having a lot of behavioral problems. I do that at home now, and my children don't have autism, so that works across the board.
It helps children with autism or teenagers with autism put together cause and effect.
Right.
So this happens before a behavior occurs, and then what happens after that behavior occurs.
Right. So you're looking at the kind of ABCs.
Yes.
Mm-hmm.
It can be offered during school hours or at home as an in-home service. I can tell you this is one of the most popular treatments for autism, and the waiting list is super, super long because as research has come out, there are more diagnoses and an increase in diagnoses of autism. So the waiting list for a lot of these programs and therapies are getting longer and longer.
You can also get speech therapy. It's about more than speech. So speech therapy, there are some common goals about improving language. It's also about learning nonverbal skills such as gestures or learning to communicate using alternative methods like a picture to point to something or technology. Some people find with autism that using those ways of communicating, the pictures or the technology, can be more effective. And this is known as alternative augmentative communication, or AAC. They'll also work on coaching children and adults on communicating in different settings. So how do you communicate with your friends? How do you communicate in a relationship? How should you communicate at work? Mm-hmm. Because we do communicate differently in those areas, and we take that for granted at how to act and behave in those settings. And then some speech language pathologists are specifically trained to address feeding and swallowing challenges with people with autism. And so they can evaluate specific issues that a person is dealing with and provide a treatment plan to improve that.
Yes. My son went through speech therapy for help with the idioisms or idiaisms, sarcasm, trying to understand and making sure his speech matches his affect. That's part of speech therapy. And introducing new foods. They cover all of that in speech therapy.
Right. And this is things that we all do naturally that we take for granted.
We don't even think about it.
It's part of our genetic makeup, but they don't have that. They're lacking that.
Another therapy that's offered is occupational therapy. And for people with autism, OT programs often focus on play skills, learning strategies, and self-care. OT strategies can help to manage sensory issues. Based on this evaluation, the therapist creates goals and strategies that will allow the person to work on key skills. And some of those common goals would be independently dressing, eating, grooming, using the bathroom, which are our ADLs, and some fine motor skills like writing, coloring, and cutting with scissors.
Right. And those are just developmental things that children need to learn. There's something called the Early Start Denver model, ESDM for short. That is specific for children between ages 12 and 48 months. And what that does is it just uses play to build positive relationships and joint activities to try to help the child boost their language, social, and cognitive skills. Again, for that younger age range is something called floor time. And this just consists of you getting in the floor and spending time with your child. And what happens is you just play and interact, and then they understand that two-way communication, because that is a little bit more complex. Like if I take your toy, how am I supposed to respond to that? Or let's play together and see how you react to that.
Well, relationships start at birth.
Absolutely. And there's this pivotal response treatment. This is something that's play-based, and it's initiated by the child. And it's based on the principles of applied behavioral analysis, or the ABA therapy. And a couple of things that you'll focus on in that pivotal response treatment is motivation, response to multiple cues, self-management, and initiation of social interactions.
Another type of therapy is called relationship development intervention. And RDI helps people with autism form personal relationships by strengthening the building blocks of social connections. This includes the ability to form an emotional bond and share expressions with each other. So emotional referencing, social coordination, where a conversation should start and stop organically, declarative language, flexible thinking, relational information processing, foresight, and hindsight.
Right. So this has happened in the past. How will that affect future outcomes?
Probability and statistics.
Right. And so a lot of these, you kind of hear a lot of the same thing over and over again. It's all about building relationships and communication and spending one-on-one time with the child.
Just developing skill sets that they might not necessarily be able to do on their own naturally. Right. So that's why early intervention and early diagnosis is so key, because we start communicating literally as babies at 6 months. We're saying mama, we're saying dada, we're saying baba.
Right.
So the earlier you're diagnosed, the more interventional help you can have.
Right. Well, and people have always said, anytime you're teaching, teach a kid another language while they're young, because their mind is just so open to all these possibilities. Same concept. They're just like a sponge, and they'll soak it up. They just have to be taught. And we as parents don't teach that. That's something that we don't know to teach unless you have the diagnosis and know to teach. Speaking of teach.
The Teach Autism program is a clinical training and research program based at the University of North Carolina. It's become a model for other programs around the world. And what it does is it provides strategies and tools for teachers to use in the classroom. And these goals help students with autism to achieve educational and therapeutic goals. Some of these Teach programs, their approach focuses on physical organization, individual schedules, work systems, and visual structure of materials and tasks and activities.
There's something called verbal behavior, which I was not familiar with at all. And that begins by teaching request. And it's a type of learning that's called errorless learning. What it does is it uses immediate and frequent prompts to ensure that the student provides the correct response each time. So what happens is if they want a cookie, you would say, okay, say cookie. And they say cookie and you give it to them. And then maybe that will progress to, what do you want? I think it starts with a C and it ends with an E. And then they remember cookie. And then eventually they'll come up to you and say, I want a cookie, without having that response.
To be prompted.
Without having to be prompted, exactly. So that's the way that that's supposed to work. There are medications that you can provide to treat certain symptoms.
Yes.
The main ones being irritability, aggression, repetitive behavior, hyperactivity, attention problems, and anxiety and depression. There are a list of medicines we could go into on each one of those.
There's so many different.
But we're not doctors.
Nope.
And you need to talk to one if
Your pediatrician?
Yes. If you need, or if you think that your child or someone that you know
needs medication,
needs one of these therapies.
So even though great progress has been made, awareness, as April is Autism Awareness Month.
Yes.
And research is being completed, there's still so much more to do.
Yes.
So I came across this study as I was reading up for this, and it's actually a study from University of California, San Diego. It's a newborn screening autism risk study, and children after birth usually have a few drops of blood that are collected from all newborn babies for various screenings of genetic and congenital disorders. So this study just kind of elaborates on it. And what it's designed to do is determine whether the dried and stored blood of children later diagnosed with autism contain the presence and combinations of biological molecules and environmental chemicals that might predict the risk of future autism diagnosis.
And there's a reason why this is so important.
This is super huge.
Every child, not children that you think are at high risk, or every single child born in the United States, they get their heel pricked and blood is taken.
Absolutely.
Whether they tell you it happened or not,
it's done.
It's done. So why this is so important is a couple of things. One, there has been a dramatic rise in the diagnosis of autism, a 15% increase just since 2012. And
that's huge.
It really is. And with all the studies that are coming out, we've said it over and over, early intervention is what is key to significantly improve outcomes. So if we are trying to understand if a child is at risk or is going to develop autism and we know it from birth, well, we're talking about, hey, if we can catch this by 2, we're great.
But if we can catch this at birth.
But if we're getting a call in 6 weeks to say, hey, there's a problem, we just got some genetic testing back, we need to be looking for this. Well, then all of a sudden we're not relying on providers to make the screening call. And for parents or loved ones who have been going through this, something's not right. Something's not right. Nobody's listening to me. Because, Rosa, this story is not unusual. This is actually very common.
It is. Later diagnosed. My son, 5th grade.
Right. Which
diagnosed.
Is age, what, 9?
9-ish. So he is already was 7 years behind the ball.
Right.
With therapies and interventions.
It's not like they say, oh, well, he's behind the ball, let's push him to the top.
Absolutely not. That waiting list, how you were received is how you're answered.
So there's crucial time that's being missed, and honestly, nothing that you can do about it.
And this is what gets me. We're already doing this with other disorders.
Right. Yeah.
So you can test for the BRCA gene for breast cancer to tell whether you're a carrier of that trait or if you're at a higher risk for that gene, I should say,
Absolutely.
to turn on.
Absolutely.
So why shouldn't we be using that same advancement and applying it to not just autism, but other diagnoses or...
Well, to anything that you could use, anything with any disease or disorder or illness, whatever you want to call it, if you know about it sooner, it's better.
Yeah.
Period.
If you have hypertension and you're diagnosed as
you get it under control, great. Diabetes,
the same.
fixing it. So it doesn't matter what the problem is. Early intervention is what's big. And this is in phase 2 trial.
It is in phase 2.
So,
and it is important because the vast majority of autism cases are of an unknown cause. So this is why the study is important. And it focuses on exposure and possible roles of chemicals and compounds and how they might interact with the genes. So autism appears to have a shared biological chemistry that is comparable, though their genes are unique. So testing will also look at more than 400 environmental chemicals in each dried blood drop.
that's amazing.
This is so exciting because the possibility to identify children at risk for developing autism before the symptoms can even appear or do appear pushes for those earlier interventions and treatments that we've been talking about.
You just can't drive home enough the fact that we're over the age of 4 is all I can find online. Over the age of 4, over the age of 4. Well, there's a big difference between a 5-year-old getting diagnosed and a 10-year-old. It's called 5 years of their life without treatment or understanding. So we know that the age in the United States is over 4. So, but that's still double what we want it to be.
Yeah.
Even if you say everybody gets diagnosed at 4, great. Right before they go into school, we know what's going on, which is not the case. But say, hypothetically speaking, everybody's diagnosed at 4, that's still 2 years too late.
You're still starting not on an even keel compared to the rest of the students that are going to kindergarten.
Right. And who's to say if we were bringing this diagnosis to the forefront a lot sooner, would that make the difference between somebody being able to grow up and live independently versus somebody to be able to grow up and have to rely on living with a caregiver or in a facility?
Absolutely.
That's huge.
It is a huge difference.
When you think about that, somebody's life.
Not only for the quality of life for the individual, but the financial ties that come with a lifelong disability.
Right.
Okay. So the hope for this study is that it'll expand to other states because right now it's only in California, but the hope is to roll it out in New York, DC, Pennsylvania, and eventually all 50 states and globally. Because autism is not just United States.
No,
it's
not.
Globally. So we'll include the study information. And if you want to have your child be a participant of this study, we'll link that information in our show notes.
Right. So the list of treatments are continually growing. And this is happening as awareness is provided and funding is improved. And understand that without funding, many children will go without the treatments and medications that they need. There was a recent study that estimated the average cost for ABA therapy, one of the main treatments for autism, is $60,000 a year. This is the cost of one treatment for one person. That's crazy.
Do you have that you can just
spend,
stacked up in your account right now?
And if you do, that's going to be depleted very quickly.
After 1 year.
Yeah. And many other children diagnosed with autism need more medical treatments and they need more medications, and that puts a financial strain on the family.
Did you know that autism patients have 40% more visits to a pediatrician than a child that does not have autism? They pay more in copays, and their caretakers and providers miss more time of work, which is also a financial strain.
Absolutely.
Children more than 4 years old have 7 times more psychiatric visits. Children 2 to 4 years old have 13 times more psychiatric visits. That's a lot, considering that a lot of children don't have one psychiatric visit.
Absolutely. My children go to the doctor. I mean, I have a daughter. She goes every other year. And I have a son that goes every year just because he's got a food allergy and we need to get an EpiPen. And so there's not that there's something wrong. It's just the fact that the provider has to see him, lay eyes on him to write a prescription.
For the EpiPen.
And that's it.
Yeah.
That's all we do.
So my child goes to his psychiatrist about every 2 months. So 6 times a year minimum
and that's just one.
Office. That's just one specialty.
Right. And that is
doesn't include his pediatrician visits, doesn't include his GI visits, doesn't include, oh my gosh, it just doesn't include. So they're also 12 times more likely to have psychiatric inpatient hospital stays. A lot of children with autism, they have behaviors.
Right.
Behaviors that need help outside of the home.
Or things that, most people aren't trained to handle these kinds of behaviors. So even though they're your loved one, to know what to do and to respond appropriately, that's hard. Even as a nurse, when it's your own family, it changes, things change. You start viewing things a little bit differently.
Mm-hmm. Autism patients have 40% higher medication costs than children not diagnosed with autism. And because of the complications, the hours, the sometimes inability to find childcare for your child with autism, 50% of parents report the need to reduce or stop working altogether.
When you think about that, half of the parents with autism, and we just told you how prevalent autism is.
And expensive.
So it's expensive. We're ramping up cost. We're having more doctor's appointments. So that's wear and tear, gas, back and forth to the visits to the doctor. All of that stuff adds up. And then we're taking away an income. That's devastating.
And if you're a single parent, one would like to hope that you have the support of a partner. But if you're
That's
a
not always
single
the case.
parent and you have a child with a disability, it's
stressful.
I can't
it's
even put it
stressful
into
with
words.
2 people, and that's having the help. And of course, I think some of that depends on the amount of support that the individual needs. But 46% of parents need more help or more information to manage emotional and physical stress. So half the people are losing their job and almost half the people say, we need more help. Go figure, those numbers are so close together.
And it does take a village. I do have a village. I'm fortunate and blessed enough that I have a village. I have my mother-in-law, I have my husband, I have my father that all pitch in and, do different things and help in different scenarios. But I know there are a lot of caretakers that don't have that.
Right.
It breaks my heart.
It really, and you can't just bring different people into the home and say, hey, I need you to do this.
Absolutely not, because that child is used to a regimen and routine and a set of people.
So you can't say, okay, I'll hire a babysitter. That they don't know, that's not going to
work.
That's not going to go over well. So in our next episode, we're going to discuss navigating the system and remembering the person. So we hope to see you there.
Next time. And we will link our references on our website, which is www.thenursingpostpodcast.com. And be sure to subscribe to our podcast. And you can always follow us on Facebook, Twitter, Instagram, and YouTube. And thanks again for listening to The Nursing Post.